then what's an agonist? It's going to give me the effect I want. What is a sympathomimetic? What's a mimic? It's going to mimic something, right? What is a lytic? If I lysis something, it kills it. It gets rid of it. Vasodilator is going to dilate out the veins, the vessels. Vasopressor, we're talking about the container, right? Ultrasound guided IV, that has saved us in the last few years. Oh wait, no. IV is not new. You'll hear IV push, IV titration. Intraosseous might be new to you guys, and it involves a drill. Inhalation is not new, but there are new inhalation drugs. We will do racemic epinephrine, which is nebulized. They will nebulize magnesium sulfate for a really bad asthma. You'll see central lines put in if you haven't before. Subclavian, femoral, and intrajugular. These are if they own some of these meds on the med surg floor, they need to go to the ICU. Epi, norepi, dopamine, dobutamine, y'all can read. Sedatives, hypnotics, amnestics. What's this? Anticonvulsants, seizure meds. Propofol. What color is it? Who to kill? Michael Jackson. I don't understand why people abuse that drug. It wears off so quick. If I was going to abuse something, damn it, I'm going to use something that's going to last more than a minute. Ketamine. It is a dissociative, amnestic. It does do sedation, and it is a really good pain. Guys, and I have argued with so many nurses, does this affect pain one iota? No. Absolutely not. Not even one hair. It is a sedative, amnestic, anesthetic. Do nurses in the state of Tennessee push this med? Unless you got a C and an A in front and behind your RN, you do not push this med. Have y'all ever seen a nurse push it? Yup, sure have. I have pushed it with a doctor standing there, and it was in extremes because the patient is pulling the IV tube out, and she was not close enough, and she is yelling at me to push it. And she wrote on the orders, I instructed the nurse to pull it in an emergency, and I was like, you better document all the way down that page as you told me to push it. It is against the law of the nursing. Boy, yeah, that ain't going to be testable. I just want you to know that. Because they might ask you to do it when you get out. Vecuronium, succinylcholine, rocuronium. You probably won't see this one very much. Y'all know what opioids are? Fentanyl, Dilaudid, morphine, hypertonic IV fluids. Usually that's going to be 3% saline. Does anybody know what this is? Dexmetadine hydrochloride, the other name? Presidex. Who's in the ICU? Y'all will see it a lot. It's a great drug. Y'all please stick with me on this. I used to teach Lifespan Farm with Dr. Butler. She came to me and said, hey, we want to teach farm. I want to teach it a new way. I was like, oh, put me in, coach. Can you memorize all these drugs? No. You can memorize classes. What are LOL drugs? Beta blockers. What are Pril drugs? This is how you do pharmacology. We're going to cram it all in. I want to know the drug class. What does that mean? Antihypertensives. Why are you giving it? What's the mechanism of action? It's beta blocker. Measurement before. We said that a minute ago. You're going to give a beta blocker. What you going to measure before? Heart rate. What you going to say is after? How you know it worked? Your heart rate came down. Safety of administration and safety of equipment. We already said that. Is your equipment working? Are you giving 150 units of insulin when you ain't supposed to be? Mechanism of action means beta blocker. Clinical use, antihypertension. Let's bring the blood pressure down. Our therapeutic, let's bring the blood pressure down. We ain't talking about chemical or molecular structure. So, I had fundamental students in the ICU. They had a great experience, and I hear a patient yelling at my student. I don't do well with that. Telling her I ain't got no problems with my junk. So I go in there ready to kill him. Why is he yelling at her? What was she trying to give him? The little blue pill. Yeah. Is there any problem that we're treating his junk? No. What are we treating? Pulmonary hypertension. That was what it was originally designed for. Hypertension, and they found out it treated that. It had the weirdest side effect. Everybody turned into a sundial. How does it work? All your blood goes to where? It drops your blood pressure, right? Why don't we give them nitroglycerin? What class drug is it? Vasodilator. Where's all your blood? So if all the blood's down here and I cause vasodilation and I change the size of the container, my blood's down here, I've changed the container, now blood's down here, all your blood's gonna run down there and you're gonna hit the floor. And your blood pressure is gonna go to what? 50 over dead. And guys, it takes a long time and a lot of IV fluid to bring that blood pressure up. Why are you giving it? You can roll your eyes if you want to. We had residents, one of my students, I don't think I've ever been more proud, that was at Vandy, and they were sitting there fighting about these adrenergic drugs and drug classes, and my student went over there and explained it to them. What is your sympathetic nervous system? Fight or flight. What effect does it have on the body? Makes your heart rate go. I'm old and fat. I'm running from the bear. My heart rate's gonna go. My pupils are gonna dilate so I can see and not fall down, running from every serial killer in the woods. I don't know why that happens. Airway is gonna go dilate. I need to breathe better because I'm old and fat. Is my stomach going to digest nothing? No, I don't need to be doing the digestion. Glucose is gonna be released. I need energy. It's gonna secrete adrenaline. Remember that. Hey, what's the other name for epinephrine? Adrenaline. parasympathetic. Pupils are going to constrict. Heartbeat's going to go down. Airway's going to, stomach's going to digest. Glucose is going to be stored. Parasympathetic, feed and breathe. Sympathetic, fight or flight. It is an autonomic nervous system. You can't just decide that your sympathetic nervous system is going to work. Now, it's also called the adrenergic, right? This has a purpose. Adrenaline and noradrenaline. Epinephrine and norepinephrine. Have y'all heard those terms about 3 slides back? Vasopressors. These are the neurotransmitters. What effect are these going to have on the body? Your heart rate's going to go. Your blood pressure's going to go up. These drugs have every effect that the sympathetic nervous system does. Well, what if I had a drug that blocked this? If I block this system, which system takes over? The parasympathetic, right? How many hearts do you have?
1.
How many lungs?
2.
This is the adrenergic. I'm using epi and norepi. 1 heart, 2 lungs. What effect is it going to have on beta? Increase heart rate. Epi make your heart go fast? Sure does. What effect does a beta-2 agonist? It causes. Why do we give albuterol? Asthma attack. I want to open up. What's the mechanism of action? It's a beta-2 agonist. 1 heart, 2 lungs. Every effect of the sympathetic adrenergic nervous system. Is this hard? It is not. Okay. Stick with me on this. Alpha 1 is your periphery. This is your circulation. It's still the container. This causes constriction. Vasoconstriction, right? We're still here. I want my blood pressure to go up, right? I'm still running from the bear and I'm old and fat. Alpha 1 is vasoconstriction. If I blocked it, vasodilation, right? So, vasoconstriction. This is my container. I got this in here. This is my container. No pressure on it, right? This is my container. I squeeze down. I'm sorry, y'all can't see that. This is my container. What's the pressure now? It went sky high. We're going to talk about that in shock. Why do vasopressors work? It ain't changed nothing but what? The size of the container. Vasopressor, you're pressing in on all of the container. Your vasculature. Alpha 1 causes the volume to press in. You ain't changed nothing but the vessel's size, the container. Does that make sense? Norepi is a potent alpha 1, right? I always think how to explain alpha 2. Alpha 2 is not on the test, but Precedex is alpha 2. This has its effect, central nervous system. This causes vasoconstriction. Do y'all want me to talk about it? It's not on the test. I don't, yeah. I don't want to confuse you.
That's right.
I can never figure out how to tell you that way without confusing you. But just know that that's what Precedex. Y'all need to learn what Precedex is if you work in the ICU. It is a wonderful drug. You need, for your practice as a nurse, and you're going to tell me that shit ain't important. I'm fixing to show you how it is. 1 heart, 2 lungs, sympathetic, every effect that the sympathetic nervous system has, this is what you're going to see. In the vasculature, the blood pressure is going to go up. Well, what if I had something that blocks this? Your blood pressure is going to go down. Do you see how this plays in? Now, these neurotransmitters are adrenergic, right? All right. Parasympathetic, cholinergic. I want you to remember this more. We had a bradycardic rhythm. We gave it atropine. Y'all know what the mechanism of class of drug that is? Anticholinergic. A bradycardic rhythm is too slow. Anticholinergic. If I block the parasympathetic, what kicks in? The sympathetic. What effect does the sympathetic have on the heart rate? My heart rate goes up. Organophosphate poisoning puts your heart rate in the toilet. You give them a massive dose of what? Atropine. It is a huge. Organophosphate comes in and just freezes acetylcholine and keeps it in there and in there and in there. I need a drug that's going to come in there and block it. It completely stops this system and lets which one come in? The sympathetic. I need to get that heart rate up. I need to quit them to stop slobbering everywhere. Why don't I want their airway full of that? Anticholinergic. This is why it's important. And you can tell me all day long, we don't write orders. I know you don't. But you're supposed to be looking 5 miles down the road. And you're supposed to understand, maybe not at first, but you're supposed to understand whether that med order is right or wrong. Somebody has come in anaphylaxis. Their breathing is bad, right? Bronchoconstriction. I want to open up their breathing, right? All this is constricting in. Hypotension is going to set in, right? So I want to open this up and I want to bring their blood pressure up. So I need what? I need one that hits both. So if I told you epinephrine hits alpha 1, beta 1, and beta 2, all right, let's keep that one in the running, and norepi hits alpha 1, which one you going to pick? Do you see why this plays in? Why would I pick norepi? Let's do another one. You had an MI 2 days ago. Your heart's sick. Let's give them some epi. They're now in congestive. I want their heart rate 200, right? Why would I do that? Am I going to give them something? Do I need their lungs open? No. They got congestive heart failure now. Do I want their heart rate 170? It might what? Might kill them. If I had something that just affects their blood pressure, pick that one? Yes. That's how this works. If you knew the receptor sites that it worked on, it lets you know if it's a bad order, right? Do they need a pressor? They do. But you're not going to give them epi. Now, what's wrong with them? They got an infection. So, their pulse is 150. Do we really need anything for their lungs? No, not really. Do I need to speed up their heart rate? No. I need to get that pressure up. Their fluid ain't where it needs to be anyway. So if I can press down, I might bring some of that fluid back in there, right? So what receptor do I need to hit? Alpha 1. I need that container to come in. I don't need epi. What else does this patient need? A lot of probably. Antibiotics and oxygen. You're right. So you can remember this. Beta 1 and alpha 1 either constricts. What is the conduct? Your heart. Beta 2 dilates. Y'all might give this in the ICU. It has its own receptor site. That's not going to be on the test. This is not a great drug. It causes dysrhythmias. But a lot of these rural hospitals, I'm just telling you, you might see it. Dopamine's not on the test. Y'all write it down. Just look at me. It's not a wrong order. A lot of these places can't afford some of these other drugs. You might see dopamine. You might see dobutamine. Dobutamine's a lot better than this. I want you to focus more on the receptor sites. So, if your order is 20 milligrams of labetalol, and they say, I want you to target the blood pressure to a map of 60, 100 mics of fentanyl every 4 hours, PRN for severe pain. We already talked. 3 milligrams of Dilaudid every 30 minutes. PRN for severe pain. So, guys, I'm trying to kind of get through this. You need to do the 5 rights every time. I mean, we don't just teach all that for S's and G's. I know those alarms, after a while, get on your nerves. You can't just sit there and turn them down or turn them off. Have y'all ever seen a nurse bypass the drug calculator on an infusion pump and just program a basic infusion rate? I bet not ever see none of y'all do that. I'm gonna beat you with a wet squirrel. Do y'all see what's wrong with that? You might not can. What's that say?
The order says 20, but it's supposed to be 10.
That's the actual label. Can you see right there? They mislabeled the bags. It's not just us that makes mistakes. What color is that? How quick can you kill somebody with this? I mean, good God, this is double the dose. Can you imagine the mistakes that can be made? Especially if pharmacy didn't catch this. This says, hey, this is 10, but it's 20. But this is a shipping label, and it says 20. Just be careful. Hey, there's another rule. Y'all have to laugh at my stupid jokes. No, I'm just kidding. Questions? No, I'm not going to tell you how many days. Guys, that cardiac worksheet is your study guide, okay? If you have looked at the shock module, you will see a study guide. It ain't nothing, honestly, but something for you guys to write on your iPad, because I figured out, y'all know I ain't the best with technology. But I did find out that the students like that so that they can write on their iPad and not have to truly take notes. So I didn't figure that out until last semester. I didn't have time to make one for this. But you will start seeing them in every module. What else? Were y'all able to see the answers on that quiz?
Yeah.
Okay, because I tried to change the things. And that was not a graded, that was just to do it, and it was an assignment, because I wanted y'all to be able to see all the rhythms and see the correct and incorrect answers.
You put those extra credits?
Extra credit.